Recently, I came across a blog that directly contradicts something I've been telling you. Now, normally this podcast would be devoted to why they're wrong and I'm right. But today, I want to tell you why they're right and I'm less right. Stay tuned. Colin Receiver here, and I got my start in dental marketing as a website designer. Back in those days, I didn't worry too much about how prospects got there. The goal was to convert them from a prospect to a patient once they got to the website. A big part of what conversion is what's called user experience, or in today's terms, UX. I've had a podcast about this numerous times, and about a month ago, I gave you a podcast that gives you tips on how to improve UX, and then followed that with a series on how you can improve your website content. Now, in all of the UX podcasts, the message generally centers around one theme. Make your website as easy to navigate as possible. Now, there's all sorts of data to support this. People already have a short attention span on the web. 55% of people spend less than 15 seconds on your website. 66% of people actually scroll down the page. Now, research that was led by PhD Jacob Nielsen shows that the average page view lasts a little less than 1 minute. Data from Microsoft research shows that page visitors are more likely to leave before they've been on the page for 10 seconds. So, when I came across a blog touting the benefits of friction, or actually forcing users to exert effort to browse your website, I was ready to give someone a verbal beatdown. But here's what the blog says in short. First, making the website visitor work a little harder gives him or her that feeling of accomplishment, make people think, and weeding out the bad prospects. Now, it's that last point that really hit home with me. When you look at the other 2 points through the lens of weeding out the bad prospects, they make a little bit of sense. But let's look at the other 2 points first. Number 1, a little effort makes dental prospects feel good when they find what they want on your site. Okay, I'm going to call BS on that one. And if you look at it on its face, you don't want your prospects you're trying to attract to face usability issues or hurdles. They're more likely to bounce than to continue to search for what they want. But looking at friction as a way to weed out bad prospects, this works great. So you make it very easy to find information about what you offer and what kind of procedures you want to attract. And for our clients, we create big buttons that talk about the problems that those procedures fix. To discourage the prospects you're not looking for, such as those looking for whether you accept their insurance or if their insurance is going to cover this, tuck that information away in a less conspicuous part of your website. Now, friction or user effort also makes people think. Now, again, you don't want the wrong people thinking too much, but let's look at writing for a second. Don't write the content on your site at such a high level that only dentists can understand it. One of the jokes I make about a lot of dental marketing is it's more attuned to attracting other dentists than it is patients. You should avoid using dental jargon. But if you're looking for people with higher income, you can probably say it's safe to write at a little bit of a higher reading level. Those with higher educational and presumably income levels will still process and understand it just fine. Those with lower education and presumably income levels may get frustrated and find an easier to understand website. So friction turns out to be a valuable tool when used to meet your goals, which is attracting the patients that you want. Until tomorrow, keep moving forward.